Colon cancer is a growth of cells that begins in a part of the large intestine called the colon. The colon is the first and longest part of the large intestine. The large intestine is the last part of the digestive system. The digestive system breaks down food for the body. Colon cancer typically affects older adults, though it can happen at any age. It usually begins as small clumps of cells called polyps that form inside the colon. Polyps generally aren't cancerous, but some can turn into colon cancers over time. Being aware of the early warning signs can make all the difference in detecting this disease at its most treatable stages. According to statistics, colon cancer is the third most common cancer in the world, but it's also one of the most preventable. Early detection and timely intervention can significantly increase the chances of successful treatment and long-term survival. So, let's equip ourselves with knowledge to protect our health and that of our loved ones. Whether you're here to learn more for yourself or to support a loved one, we're here to empower you with vital information. Hello, everyone. Today, we're delving into a topic that demands our attention: the early warning signs of colon cancer. It's crucial to be aware of these symptoms and act promptly if you notice any concerning changes in your health. Remember, your well-being matters, and consulting a doctor for any persistent or worrying symptoms is essential. Let's empower ourselves with knowledge to protect our health and the health of our loved ones. Let's get started. 1. Blood in stool. The presence of blood in your stool or rectal bleeding should never be ignored. While it can be caused by various conditions, it's essential to have it evaluated by a healthcare professional, as it might be a sign of colon cancer or other serious gastrointestinal issues. Rectal bleeding, also known as a stool in the blood, refers to a mix of bright red blood and stool from the anus. A bright red-colored stool indicates a growth close to the end of the left colon or rectum. The blood will also be a brighter red depending on the proximity to the bleeding site. The bleeding occurs in the gastronomical tract, making it a symptom to watch out for, as it is a distinctive part responsible for diseases such as colon cancer. 2. Constipation. On the other hand, cancer patients may also experience constipation, which is having 3 bowel movements or less in 1 week. In this case, constipation is usually chronic and held for a very long time. However, some patients experience an alternation between diarrhea and constipation, which is caused by an altered intestinal transit caused by the growing tumor. Constipation is usually caused by nutritional factors as well, and in most cases consuming more fiber is enough to treat it. However, when it is coupled with alarming symptoms like changes in the stools and rectal bleeding, we should search for medical guidance to reach an early diagnosis and treatment. 3. Abdominal discomfort. Frequent and persistent abdominal pain, cramps, or a feeling of fullness might be early indicators of colon cancer. Abdominal pain is a form of pain that occurs between the chest and pelvic regions of the body. It can come in various forms such as cramps, bloating, aching, sharpness, and so on. Certain diseases that affect the organs located abdomen can cause abdominal pain. The large intestine is one of the organs located in the abdomen, and the organ is particularly associated with colon cancer. Continual or persistent abdominal pain is one of the symptoms which is part of the early stages of colon cancer. Therefore, it is expected that individuals are open and sensitive to signs as this. Don't ignore these symptoms, especially if they persist or worsen over time. 4. Unexplained weight loss. Unexplained weight loss is a symptom that should never be overlooked, as it can be a red flag for various underlying health conditions, including colon cancer. In the context of colon cancer, unexplained weight loss may occur due to various factors. Cancerous tumors can alter the way the body uses nutrients, leading to a decreased appetite or difficulty absorbing nutrients from food. As the cancer progresses, it may cause the body to use more energy, further contributing to weight loss. If you find yourself losing weight unintentionally and without any apparent reason, such as changes in diet or increased physical activity, it's essential to take this sign seriously and seek medical evaluation. 5. Fatigue and weakness. It is not uncommon for people who are suffering from any type of cancer to feel fatigued and weak, including colon cancer. The reason why fatigue and weakness is such a common symptom of cancer is that the disease compromises your immune system. In other words, your immune system goes into overdrive in an effort to try to fight off the disease. This takes a lot of energy, leaving very little energy for anything else. If you find yourself feeling constantly tired or weak without any obvious cause, it's essential to consider potential health problems, including colon cancer. Persistent fatigue should never be dismissed, as it may indicate an underlying condition that requires medical attention. 6. Anemia. Anemia is a critical symptom to watch out for in the context of colon cancer. It occurs when there is a decrease in the number of red blood cells or a lower level of hemoglobin in the blood. In the case of colon cancer, anemia can result from internal bleeding in the colon. As cancerous tumors grow, they may erode blood vessels, leading to slow and chronic bleeding that goes unnoticed. The decrease in red blood cells affects the blood's ability to carry oxygen to various parts of the body, causing a range of symptoms. Low levels of red blood cells caused by internal bleeding from the colon can lead to anemia, resulting in weakness, fatigue, and dizziness. If you experience symptoms of anemia, such as paleness or fatigue, it's vital to seek medical evaluation to determine the cause. 7. Narrow stools. Pencil-thin or unusually narrow stools might be a sign of an obstruction in the colon. Colon cancer grows to the intestinal lumen because it is usually located in the internal lining of the colon. For this reason, as it grows, it progressively reduces the available space for the regular transit of stools. When it has grown large enough, you can start noticing a change in your stools, making them narrow because of the tight space they have left now that the tumor is obstructing the intestines. If you notice this change, it's essential to discuss it with your healthcare provider to rule out potential issues. 8. Night sweats. If you are frequently waking up in the middle of the night drenched in sweat, it is very likely that you have some type of illness. Night sweats can be a symptom of several conditions, such as the flu. However, it can also be a sign of colon cancer. The cause of night sweats is due to the fact that your immune system is working in overdrive as it is trying to fight off cancer. 9. Feeling full and bloated. Changes in your bathroom habits should always be noted, and if something serious has changed, then you are better off reporting it to your doctor. The thing with most cancers is that the sooner they are diagnosed, the better your chances are of beating it. Especially colon cancer is a type that you would much rather spot and treat early on. Being vigilant about your health and recognizing potential warning signs can make a significant difference in the early detection and successful treatment of colon cancer. If you found this video helpful, please give it a thumbs up and share it with others to raise awareness. Remember, your health is your most valuable asset, so don't hesitate to take action if you experience any concerning symptoms. If you have any questions or personal experiences to share, please leave them in the comments below. And don't forget to subscribe to our channel and hit the notification bell to stay updated with our latest content. Thank you for watching, and until next time, take care and stay proactive about your well-being.